Hi everyone, my name is Karen Moorhead, and today we're going to be talking about patient care and rights. You may be asking yourself, why do you need to know about this? Well, because either you or someone you love may be in the hospital at some point, and you would like to know their rights. Some of the points that we're going to go over is the right to refuse care, HIPAA laws, and your dietary. And I'll be using my personal experience as a certified nurse at the hospital for 5 years. First, we're going to touch about your right to refuse care. So this means you may be wondering about what can you refuse, like we do vital signs every 4 hours, so 8, 12, noon, and then at midnight and 4 in the morning. So then some people don't like to be woke up, and you can tell your nurse that you don't want your vitals to be taken, and they won't come in and disturb you. And then such as your hygiene, we can't make you brush your teeth or take a bath or change your linen or anything like that. And then turning, if you can't reposition yourself in bed, we come in and we turn you every 2 hours. And then you have the right to refuse that care, but if you do, then we document it, so therefore it protects us from lawsuits or saying that we didn't provide care. The only thing that when you have an altered mental status, you can't refuse your primary care. We come in every 2 hours, turn you, change you, make sure you're dry, things like that. The next thing we're going to talk about is your HIPAA laws. HIPAA laws are here to protect not only you, but as your patient care. According to hh.gov, the individual, past, present, or future, physical or mental status cannot be shared with anyone outside of your primary care. So they're not your nurse or your aide or your doctor, then they do not have the right to know about your patient care. Or anything that can identify you, your age, your race, anything that someone that can identify you by. It is also there to protect why you're in the hospital, so we can't know why you're in the hospital or if you're being seen for something. That's strictly against HIPAA law to share. And with protecting the patient, we also have to take care of the needs, so then therefore we go to dietary. When you're at the hospital, we have boards in the room that state your nurse and your aide, and then you'll see a dietary, and there's an extension you can call on the hospital phone. Most patients don't know if you call that number, you get the dietary office, and as long as it's in your dietary guidelines that your doctor has provided, you can get anything. So if you're on a regular diet, even though if it's not ordered for the day, you can get chicken fingers or a cheeseburger or grilled cheese, anything like that. Dietary numbers, and like I said, is in every room that you go into, and most patients don't know it's there. And then I've learned that people will forget what you said, and they'll forget what you did, but they'll never forget how you made them feel, and that's important in healthcare when you're taking care of people. And that quote is by Mary Angelou. So with that being said, the laws are to protect your patients and yourself. And I hope by this you've learned a few things the next time that either you or a loved one is at the hospital.